Welcome to today's Google Hangout, brought to you by TenCate Fabrics. No matter what personal protective clothing you're wearing in the fire service today, the chances are the fabric comes from TenCate. Remember, when you're speccing out gear, don't always just rely on the manufacturer, but also reach out to the fabric dealers out there because they can answer a lot of your questions, give you unbiased information, and help you with your risk assessment for PPE. We really like to thank TenCate Fabric for sponsoring our show today. We got a great show today, and we're going to be talking about a resource that is in your district, whether you're a career or volunteer department, that kind of gets overlooked. And we've been very fortunate. And I've been in the fire service for 20 years. And besides 9/11, where we really heard about the operating engineers stepping up to help our brother and sister firefighters, as well as Americans across the country, it was really a resource that was even unknown to me. And then through my brothers who were on the state collapse team, I was introduced to Kyle. Now, Kyle Zimmer is the health and safety director for the operating engineers. He has a national role. I'm going to have him tell us a little bit about himself. We're also here with Jerry, who's the EAP guy that helps out the operating engineers with all the issues, because firefighters and construction workers are very similar in all capacities. I'd say our membership is very type A personalities. They work really hard. They're the guys that take a shower after work, not before work. So I think it's important that we realize that we do have partners in the community, and New Haven has utilized the operating engineers in so many ways on emergency calls, on EAP issues, and on working together. So Kyle, if you can introduce yourself, and we'll kind of start off by explaining who you are and what's your role with the operating engineers. And for some of our listeners out there and viewers, they might not even know what an operating engineer is. We got a lot of college kids that are coming right in. So talk about the trades a little bit.
Oh, thank you, Frank. Hello to everybody. As Frank said, my name's Kyle Zimmer. I'm the health and safety director for Local 478, which is the local here in Connecticut. We represent about 3,000 operating engineers in the state that work on construction projects, heavy and highway construction. They range from crane operators, excavator operators, any type of heavy equipment, and the mechanics that go along with heavy equipment. We also represent shops and plants that produce material to supply our contractors with the materials to build the roads, bridges, and buildings that we work on. My role came about, I've been involved with the Local 478 now for about 15 years. I started my career here as a health and safety trainer up at our school. We have an apprenticeship training school and skill improvement school up in Meriden, Connecticut, and I was responsible for doing all of the health and safety training, OSHA training, things along that line. When I first got in the union, my career in the fire service spans over 40 years also as a volunteer firefighter in South Windsor, and taught for the Connecticut State Fire School for a number of years as an adjunct instructor. So I knew the fire side also. And then when I got here involved with the union, we had been ancillary working around some programs that our international union had developed to help local fire departments with heavy equipment training, disaster recovery, and things like that. And then when I got in, I got very involved. And in 2011, I was transferred to the union side, which really allowed me to grow the program a little bit. And we'll talk about what our members assistance program does in a little while. But those are my responsibilities now.
Just some things right off the bat. Kyle talked about their training school. And for example, if you're going to take a class in trench rescue, you got to be able to dig a trench. Who better to dig a trench than an operating engineer? But it also goes beyond the skill of digging the trench. Who are you going to be dealing with when you go to a trench rescue? You're going to be dealing with a member of the operating engineers, most likely. So building that rapport with the workers between the fire department and realizing that, because some fire departments will arrive on scene and they'll be like, we're here. These guys are construction workers. They do this every day. you don't want to put your hand up. You want to put your hand out, bring the individuals in, and make them part of your plan. And I think that that's what's missed a lot of times in rescue situations. So getting the exposure to people and individuals that are skilled and trained before the emergency incident in a training incident is so critical. And right now we're in the process of setting up trench rescue training at their site. And typical fire department, they didn't know about it until today. So now,
well, and that's okay. We're used to that, but we'll work through those issues. Prior to 9/11, a lot of the response activities that happened on a national level, whether it was hurricane, tornadoes, act of terrorism, you name it, the fire departments were hesitant to bring in contractors, and they did it when they absolutely needed to, and there was pretty much no planning prior to the incident. After 9/11, it became very apparent through the presidential directives and FEMA and the programs that they put together that, we need to act as a team. We need to have heavy equipment as a resource. We need to know what that equipment can do and how it can benefit the fire service and recovery and rescue efforts. And that was very apparent in 9/11 when the recovery effort took place. Some of our members here locally in Connecticut were among the first on scene. They cleared the streets to get in that night, and the stories that they told were very powerful and moving. And that'll stick with me for the rest of my life. But how we started to work with the fire service as a whole right after that event was very impressive. Fire department started to reach out to our international organization. Now, our international organization encompasses all of the United States and Canada, and we have about 400,000 operating engineers. And the way it's broken up is some of our operators also work in plants or work in buildings. They're building engineers, HVAC, and things along that line. So they play into the disaster response also. One of the things that I'm responsible for in our union on the international side is the teaching of the disaster site worker class from OSHA class 7600.
Now, this is why things like this are so important, because while I knew that operating engineers in the fire departments were working together informally, today was the first time that I learned about disaster training for the operating engineers. So I'm out there reading everything, talking to everybody. Yeah. I've been with Kyle several times, but this is the first time that I'm learning about it as well. So this is important to realize that. So operating engineers in their disaster training are getting trained in incident command system.
Yes, incident command system. When our members finish the disaster site worker course, which is a 16-hour course, they're trained in respirator use. They all have had prior OSHA 10 training. They've had hazmat 40-hour training. Those are prerequisites to take the disaster site worker course. So this is another tool in their tool belt. They go through the 40-hour hazmat course for site worker cleanup. We add the unknowns of disaster hazardous material hazmat, because it is different. It's an uncontrolled thing. So we talk about that. Make sure that they're proficient in respirator use. We go through, donning and doffing, the whole maintenance procedures on them. And our members, if they complete the 40-hour HAZWOPER course, they're trained up to level B. They can put on level B suits to go into a site. So the training that they have is when you call, you're going to get a trained personnel.
And the key is for the fire department to operate safely, efficiently, and effectively on a construction site or on a job with operating engineers and a lot of fire departments make this mistake. In New Haven, we used to make the mistake and we corrected it. When you arrive on scene, and this goes for any hazmat or any industry thing as well, find a competent individual who's familiar with the equipment, familiar with the personnel that are there that day, and you want to essentially, Justin McCarthy and Greg Bovin, a captain and lieutenant on our job, wrote the article after we had a construction worker fall in a smokestack. Right. And they were able to work with the operating engineers to come up with a plan to help rotate out saws. But and I've had this happen at a hazmat call too, you get that competent individual who also has other responsibilities and has other bosses. So you bring them into the command post, and then that person gets a cell phone call, and it's usually about the incident, and you lose them for that second. Whenever you need them, you turn around and they're not there. So what we recommend departments across the country is don't repeat some of the mistakes we made in New Haven.
Right.
Grab that individual, lock them in the bullpen, and at the very least, assign a firefighter with a radio to be with them. That way, if they get a phone call or they have to talk to somebody that pulls them out of the command post, you know you can get them back at a moment's notice. And we just saw this we had a hazardous material spill. A worker got acid on him. And you had the person from the site there, the safety person there for a second, and they only left for a second, but now you're looking for them. So resources, better to be looking at them than looking for them. So assign somebody with a radio and put them there in the bullpen, because now I can ask Kyle Zimmer, I can say, hey, what do you have for saws? What do you have for cutting equipment? Let's come up with a plan, or what's our plan B? Because they're going to know the site. They're going to know the location. They're going to know the capability of the equipment. And the chances are there's going to probably be something on site that can help you out. I want to go back to Buchanan Marina. Confined space training in a training facility is great for your first certification. Where you run into problems is when guys and girls go through the same training in the same site over and over again. We want to get out into the community for health and safety, and we want to work with the construction workers on site. So what we try to do in New Haven now is change the site of our confined space training once a year. So every year you're working in a different site. So you're working in a different place with different people. You're building the reputation of your fire department. You're building relationships. And at Buchanan Marina, here we have operating engineers going into a confined space, I think 10 hours a day, 4 days a week. It's just a matter of time before somebody has a medical emergency or slips or falls, and the fire department has to come there. So we're working with Buchanan Marina right now, and instead of putting off the operating engineers, we're actually putting them into our plan. So September 8th is our last day of training, and then after talking and getting input from the operating engineers on what would be the best way to get them out, because remember, they want to get out too. Management wants to get everybody back to working safe. Labor wants to go home to their family safe and keep management working. It's a mutual interest. So we determined that their cutting ability is going to be beyond the fire department's cutting ability. So as long as we can make sure that they check off a couple boxes, make sure there's no torches or any hot work going on, they pull it out, they start ventilating. We're actually, as part of our plan, as Plan B, we're going to have them 20 feet away from where their known worker is to start the cutting operation after all hazards are eliminated, everything's tagged out, which it already should be, and they start ventilating. And then when we get there, we'll start with the Arizona Vortex, start with supplied air, start getting in, and whichever gets there first will remove. And that also keeps the site moving, because remember, construction workers, they want to do something. So if you can assign a firefighter with that crew, and we talked about our first new engine company, taking one member, putting him with a competent individual, and then putting one member with that cutting team is going to be something that policy is going to come up. But we think you're a great resource. Just a lot of firefighters don't know about it.
Yeah, and you know, one thing that I see, knowing both sides of the story here with the fire service and the labor side, our guys want to do something. When something happens on a job site, whether it's a trench collapse, whether it's a building collapse, whether it's a confined space issue, our guys want to get involved, like you said. One thing that we can do, and we do it through the disaster site worker class training our trainers, is to lay out a plan for our workers to know that they're going to be included. So, you know, we always talk, it's nice to meet each other before the incident happens, familiarization with everything, operations. That's very important. If you look back at building collapses throughout the years, and I'll use another Connecticut example, the L'Ambiance Plaza, back 40 years ago. You know, at that time, I was just starting my career with the insurance industry, and I actually got down to that site. And one thing that struck me on that site was it looked like an anthill. Everybody was And it was nobody's fault because it was just the way things were done back then.
Correct.
It looked like an anthill. Everybody just clambered onto the pile. They worked long hours. People were sustaining, injuries. Nothing serious, but it could have been very serious. You had shifting structure, and people didn't read the building. People didn't understand how to manage personnel on a rescue site. And I look back at that, and I look at where we're at now, where we're training together, where we're communicating together, and people understand why they need to step back a little bit. Going back to another Connecticut tragedy in 2010, we had the clean energy explosion, the power plant explosion, and 6 trade workers tragically lost their life. But if you contrast those 2 sites, you had the anthill with all the workers on it, and then we had a controlled environment where we set up staging area for the construction workers coming in. Because like you said, we bleed red just like everybody else, and they want to be there, they want to help. And we segregated. Here's welders, here's operators, here's this, here's that, here's laborers. We had it all segregated out. So if, in fact, we did need personnel, we needed 6 cutters. Okay, go down and help. You got accountability, you got it all planned out, and it worked seamlessly. And that's our goal, is to make sure everybody goes home. Just like the fire service and the construction trades, everybody goes home.
And I'm sure there's some operating engineering sites who haven't taken this training, but by the fire department going there, it's just like anything else. There's things fall through the cracks all the time. That's why we have fire engineering. That's why we have Google Hangouts to try to keep everybody informed. We could all do a better job. So just by you as a firefighter or fire chief or training officer going to the operating engineers, it might even key them in that this is a resource they have at the national level to reach out. Would you agree with that? Because it's how the fire department.
First of all, a lot of our members volunteer. So, once they come through our training, they kind of naturally just bring it together. But a lot of times when I'm teaching this course, and we got one coming up in the end of September, I'll say to the people in the class, I said, go visit your fire department. Invite them to your training site. Let them know what you do. Cranes, for example. Cranes are all over the country, all over the world. They're a great resource for you folks to have if you have a scenario where you have a building collapse and you need to lift stuff, excavators. Learn what the machinery can do and learn where to get it.
Down.
There you go.
Get the load off, my friend.
You passed it. But yeah, there's a lot of stuff out there that you can use, a lot of resources. The possibilities are endless. I mean, we've done training out in Seattle with Seattle Fire Department on tunnel rescue. I had the opportunity to go out there and work with those folks. And what they knew about the operating engineers was incredible. They knew more about that local when I got out there than I knew about it.
And they're going to know their work site. They're going to
know their work site.
For example, and I don't know if the operating engineers work there, but anywhere where you go, you got to rely, there's got to be a little bit of faith in each fire chief out there. You got to have enough knowledge to check the other person's knowledge. You don't got to be the expert. But as long as you know enough about it so you can check who you're talking about, that this is the competent individual you want to be talking to, they know their areas. They know what can be shut off, what can't be shut off. Like we deal with Yale steam tunnels. There's some pipes that you're not getting shut off. You want to make sure you're getting the right answer from the right person. And the only way you're going to do that is if you get out of your office and you start doing some training together. We met with Metro North today, but again, it's a specialized field with the trains that we want to start doing some training with them. So if a train goes through your area or a crane goes up, you better start making the contacts because the workers are concerned about their safety as well. We had a tower crane come up in New Haven and we missed the opportunity. The operating engineers wanted to do it, the construction company wanted to do it, the fire department wanted to do it, and then it never got done. So the next tower crane that comes up in the city, we're going to make sure we do a drill because you can't expect your personnel to perform at 3 o'clock in the morning when things are a little bit tougher if you're not going to let them train on it during the day. So that's a lesson to the fire chiefs out there. You gotta let your personnel train. And when we brought up the need to train in the tower, we were worried about the individual having a medical emergency, but we were also worried about the kids putting a banner up on there.
And very common.
Lo and behold, A week after we brought up the issue, somebody climbed and put up a banner. So what happens to that kid? Now you got a heavy rescue that's going there that never been to the top of the crane. We can't operate that. And I got to give credit to Chief Alston in New Haven. He's changed our whole genre of how we do training. We've been off the East Rock. We've been off the Q Bridge. We're really starting to come into an all hazards, and working and continuing working with operating engineers is something that we definitely want to continue and reach out to them because it's such a great resource. I want to talk about move the conversation, and we're going to get in a little bit in the EAP. But before that, I see Kyle Zimmer at the state capitol advocating for workers all the time, because whether you're an operating engineer or whether you're a firefighter, if you're not at the table, you're on the menu, as I like to say.
Absolutely.
And can you tell us a little bit about your role at the Capitol? Because I've reached out to Kyle on issues before for PTSD, worker safety, and because we're all in this together. So talk a little bit about what you do at the Capitol.
A lot of my involvement in the Capitol is revolving around safety, OSHA laws, environmental laws, and now with the substance abuse issues, misuse issues around the country. Also with that, protecting our interests and our members as much as we can, along with the safety issues that we have, and just trying to keep things from going backwards right now. We do a lot with prevailing wage. We do a lot with PLAs, project labor agreements, to keep work in state, using the right contractors, you're doing the right thing.
For fire chiefs and firefighters up there, I actually think and I don't want to go into it too much, but I think that there should be an understanding, because as a fellow union president, I didn't understand what they always put fancy terms on things, so nobody understands what they mean. So could you explain to our listeners, because if you're talking to somebody from the operating engineers, those two things are going to come up. So there should be some basic information, because if we could speak the same language and understand some of our own issues, it actually helps everybody out. So could you explain those two things?
Sure.
We have some time.
Prevailing wage is basically the Davis-Bacon Act, which was affected back in the 30s. When we were coming out of the Great Depression, it basically set the standards for wages, for a fair living wage. And it's grown throughout the years, and each state sets their own prevailing wage through the U.S. Department of Labor. And basically that's your minimum wage, and that's what your wages are.
But there's been some pushbacks on that.
There's a lot of pushbacks to change that, to lower what a trade worker would make. Without getting into it, we need to keep our prevailing wage levels where they're at now. We can't afford to go backwards. What that does is that just hurts the crafts, hurts all the building trades, and that's something that we don't want to do.
We can't make America great unless construction workers can eat.
Exactly.
And feed their families.
Infrastructure is very important to this country right now.
That seems to be a bipartisan issue.
It is.
We might actually find some common ground with Democrats and Republicans.
It could be. It could be a very good issue. But right now, with the way things are moving politically, the environment that's out there, we're very concerned that the funding for the infrastructure is not going to take place, and roads, bridges, and our infrastructure, rails, and airports are going to suffer. They're behind the times right now with maintenance and replacement. So, we saw bridges go down in the past. We had the Mianus River Bridge here in Connecticut in the 80s go down, and more recently, a few years ago, the I-35 bridge in Minneapolis.
And the more workers are out there improving our infrastructure, the more chance of them getting injured. And I want to make another quick point. Since we started reaching out, and this is important for our fire chiefs and union leaders out there listening today, since we started reaching out, management, when they see the fire department and the workers coming together for health and safety, because we don't want people to get hurt, because that's lost days. So this is something that management and labor generally agree on, is health and safety. Keep people.
Yeah, it's very important to work safe. A lot of many of our contractors rely on workers' modification, and that is how your injury rates. and that's how they bid the jobs. And you know, you want a good modification rate, and you can get awarded jobs, and that is working safely.
So they look at, when they're bidding jobs, they're looking at the safety rate, what the OSHA rate is, on whether they hired. My brother's a safety officer, and he says that that's real important enough. If you keep getting a lot of injuries, people don't want to hire your company. But my point in being is that what we found is, we all know that our budgets are suffering across the country for fire departments. And when it comes to specialized operations, for example, with Buchanan Marina, the way the bulkhead is over the manway, a normal tripod will not fit over it. So you can't use it. So we were relegated to using tower apparatus as a change of direction. And by explaining that tower apparatus, because we have 4 ladder companies in the city, but only one's a tower. If that tower's at a fire, we're not getting that tower apparatus to that worker at that point in time. And without asking for it, Buchanan Marina stepped up and bought the fire department an Arizona Vortex. Operators on the Q Bridge called and said they're operating to inspect on the Q Bridge. We went up there and realized that in our pre-plan that we're going to have to do a lowering operation if somebody gets hurt inside the Q Bridge. The company doing it bought a new Stokes basket, a new bridle, 4-to-1 systems that not only will help us operate efficiently on the Q Bridge to help out a worker, but will help us at Buchanan Marina, will help us across the board. So
that's important for the fire service to realize, that they need to communicate their needs to the contractors, to the owners, reps, and to the union. When you get on a project, if you don't have the capabilities to effect a technical rescue, that doesn't do anybody any good.
Right.
Doesn't do the public any good, doesn't do the workforce any good. So that's why, you know, Connecticut right now has a tunnel project, something that we've never seen. We've had no underground construction experience in Connecticut at this level with a tunnel boring machine. And right now the local fire department is in negotiations with the contractor. They're in negotiations with us, the labor force, to make sure that the training level is there when we start going horizontal. Right now we're doing a 270-foot vertical shaft.
Wow.
Yeah.
What's the tunnel for?
The tunnel is a conveyance tunnel for the Metropolitan District Commission in Hartford. And basically what it is part of the Clean Water Act.
Okay, so it's a water tunnel.
It's a water tunnel. It's a holding tunnel for stormwater runoff, because the plant is not big enough to process the volume of water. So it'll be held in the tunnel and then processed at a slower time, just discharged into the river. But here we are, we're just starting the project. We're 6 months into it, which in a tunnel project like that, a 5-year project, is still the start. So we're planning the training that's going to be needed for a tunnel rescue team. And that'll be a blended team. That'll be firefighters and labor force, as it should be. But this happens all over the country. This isn't, specific to Connecticut. We're talking about Connecticut right now because that's where we're at, and that's where we're familiar with.
Another benefit we're working with the operating engineers and doing these site training things is you also can ensure that when there's an incident that they send somebody to the gate to get you in, because on a construction site, it's not the same as pulling up to a 2.5 wood with smoke showing. We have the harbor here. We have the same issue. You need somebody to meet you at the gate to get you in. And unless you communicate and do the drills, and I don't think if we didn't do the drills at Buchanan Marina for our confined space this year, I don't think they ever would have bought us anything to improve, because if we didn't do the drill, we never would have known our limitations. So imagine if we showed up there without a tower apparatus for a worker who broke his ankle or somebody having a heart attack, and we found out that day on that space that the tripod doesn't work, and now it extends our operation. So really, you got to get out there, make those relationships, start training. And that's another thing besides putting the person in the bullpen, make sure they know to send somebody to the gate. Because I can imagine this operation in Hartford, there's going to be a lot of different places that people are working.
Oh, yeah. Well, it encompasses about a 6-mile tunnel or a 4.5-mile tunnel. So you probably have a 6-mile radius of where work is being done from the launch shaft for the tunnel boring machine.
And the other nice thing about a union job is they're generally going to have a safety officer either there or somebody that you can get in touch with to develop a pre-fire plan. fire chiefs and training officers, we always think of it just as us. But if they're doing a prolonged operation, if you bring them in, you can already get them to start the process of what's going on, of getting good information, because getting good information and finding the right location are generally the two hardest things to do on any construction.
It's like anything else. If you build a foundation and you have the knowledge and the tools, the rest of the operation is going to go easier. And that's to us important. And our foundation is good health and safety plan. Our tools are our knowledge and communication skills with people that we deal with, the emergency services. It's much easier to deal, and I said this before, and I'll say it again during this broadcast. It's much easier to deal with somebody that you know on a non-emergency situation than it is when you pull up and everything's coming down around you. So, build those relationships now. Reach out to your local operating engineers. We'll have my contact number, I guess, for you.
We're going to make Kyle write an article for fire engineering or fire rescue. It's mandatory. So that will be coming out, and we'll also link it to this show so that when somebody views the show, they'll be able to go right to the article.
And we can put you in touch with whoever you need, from the operating engineers. And like again, this goes all across the country and in Canada. Our sister locals in Chicago, California, DC, all around have relationships with the fire service and very strong relationships that have gone back a number of years, and everybody knows everybody and who to call and when to call.
We're going to move to the EAP portion of our thing. So I just want to thank our sponsor at the half hour here, that we really appreciate TenCate Fabrics, naturally fire resistive natural materials. They cover the full gamut. And please, if you're buying PPE, reach out to the fabric manufacturer. Don't just get pigeon-toed into talking to one gear manufacturer over the other. Bring in multiple resources so you get all the information so you can make great decisions. But TenCate Fabric has been sponsoring the show since we started, and we really appreciate it. Make sure you check out their booth at FDIC when you're out in Indianapolis this year. Maybe we'll have Kyle teach a class about the operating engineers coming in the future. But we really appreciate TenCate Fabrics. Before we move on, I just want to say one other thing about Kyle's work at the Capitol. And unions sometimes fall into the trap of being too partisan. And as a lobbyist, I know Kyle's reputation up there. And the fact is, he's not viewed, and I don't know what his politics are, but he's not viewed as a Democrat or a Republican at the state capitol where you automatically get the door closed on you. He is viewed as an advocate for health and safety. So remember, if you're going to be the face of your organization, I'm more political than most. I can't hide my political affiliations, but people know that I always advocate for firefighters. And that's the same thing with Kyle. He's known up there, not as red, not as blue. He's known up there as fighting for health and safety for workers. So if you're out there and you're advocating, don't get so closed off that I'm not going to talk to this person because they're a Republican, or I'm not going to talk to this person because they're a Democrat. You need to talk to everybody and educate them about your issues, because sometimes the door that's closing on you is because you don't have the relationships and they don't truly understand the information. And remember, when you're up advocating for health and safety, whether you're an operating engineer, whether you're the EAP guy or a firefighter, we all don't know each other's language. We all have this nomenclature. So I could sit here. It's like when my neighbor's a Green Beret. He talks in acronyms. I have to say, stop. I wasn't in the military. Break everything out. Prevailing wage. Firefighters don't understand that. And most people won't say, I don't know what you're talking about. So they just nod their head. So if we don't break it down to the very simplistic things to educate people, sometimes we're doing a lot of talking, but we're not doing a lot of communicating. And Kyle's known for breaking it down to what's simple and getting things done for workers in the state of Connecticut. And like I said, he didn't even know I was going to say that, but I talk to everybody he talks to up there because I'm in Hartford constantly. And that makes a difference because people listen. I want to introduce Jerry. And one of the reasons that the EAP part and why I know this is our past chief, acting chief Matt Marcarelli, when we've unfortunately had some construction worker accidents over 10 years. New Haven's a big, small city that there's always something going on, where we had some workers injured and unfortunately died. And my chief immediately reached out to Kyle, and they put in some programs with PTSD that, you know, and controlling the symptoms and getting early intervention. And I think you would agree, Jerry, that
Yes.
the key to managing PTSD symptoms is early intervention. Can we all agree on that?
Definitely, early intervention is very important, and it's good to have a member of your union who is trained, and also possibly an outside person like myself who has a union background, a member of the Machinist Union for 36 years, now retired, to when something happens, to be in the background at that site, like at the Clean Energy explosion. There were some labor assistance professionals from different labor unions around the state that were there, and not to do anything on the site at that time, but just to have maybe bottles of water ready, have their business cards there, and people come by, they might pick them up, and it might be a week or a month later when that person who saw the tragedy, or their family member was involved in the tragedy, where they're having trouble sleeping at night, or they're drinking more than usual.
What company do you work for? Can you give us a little bit of your background?
Yes. I was the union member assistance coordinator for the Machinist Union at Pratt & Whitney the last 15 years that I worked there. And myself and a few other people in the state of Connecticut were the founding members of the Connecticut Labor Assistance Professionals Chapter. It's a national organization, and we started the Connecticut chapter. And that's where I met Kyle about 4 years ago, when he was actually looking for some assistance after the clean energy explosion. And when I retired from Pratt & Whitney in November of 2015, I was a licensed clinician, certified employee assistance professional, and I decided to buy my own business and start a mental health and addiction counseling practice called Connecticut Counseling and Wellness. And this past year in January, we partnered up with the Operating Engineers Local 478, and we're a part of their member assistance program.
How are you activated? Are you activated by somebody on site when we're talking about construction worker death or significant injury? Is that how you get activated?
Yeah, what happened, actually it's been longer than 4 years, Jerry.
Yeah.
2010 was clean energy.
Wow.
I responded to clean energy as a member of Connecticut Task Force 1, the state urban search and rescue team, as a safety manager. And while I was up there, I saw all our members that were affected by the tragedy. And I said to the business manager, I said, we need to do something. He said, what do you want to do? And I said, we need to get these guys into some counseling. The team that I was activated on was immediately told we had to be here for debrief, so, it kind of went along with what the fire service was doing. It was what the fire service was doing. But our members were kind of left in the lurch. They were, walking around, okay, it's time to go home. And, they had no debriefing. They were given no resources on how to handle it. And I said to the business manager, I said, we need to do something. He says, well, go ahead and do it. Do what you need to do. And we did. I called in the Connecticut State team, and they did a debriefing the following day for us, and it was very well received. That was the start of it. Just caring about my brothers and sisters, just caring about them and making sure that they had the resources that they needed.
We don't want anybody to suffer in silence.
No.
If you can get that early intervention, get people together, get people talking about it, may not help everybody. There's some people it may have no effect on, but just knowing that somebody's there makes a big, big difference. And having somebody from their own field, seeing Kyle Zimmer, who's an operating engineer, show up, who they know, makes a big impact. Just like the fire department we use in New Haven, we use PJ Norwood from East Haven, comes in and does our peer support. So peer support backed up by a clinician, I think, is one of the keys to success. And I get a bad rap across the country because people take that visceral response of seeing, well, Frank Ricci was against the PTSD bill because it was another unfunded mandate to our cities. No, by just saying, oh, well, he's against PTSD. Well, no, that's not the case.
The right care.
I want people to have a pathway to treatment, to better health, where it doesn't lead to further EAP issues of drugs, alcohol, and we'll hit upon it today about suicide, because it's a huge impact in both of our industries, and the fire service hasn't even really started tracking the numbers. And we know that their work is a contributing factor. It may not be the whole thing, but it's a contributing factor. And we need to do a better job of taking care of each other. And one question I got for you is, with alcohol and drugs, the early intervention seems to be the best, because a lot of firefighters, and I would assume construction workers, believe that covering something up is actually helping the individual. And we've seen that fail drastically, that we could really be negatively impacting the person's life, their family life, criminality, and everything else by just trying to help the person by covering up. We're not really helping anybody. Is that?
Exactly. And one of the things that Kyle and I have really stressed in our teaming up in this is that we want utilization of the EAP, MAP, and all the acronyms, right? Employee Assistance Program, Member Assistance Program, Labor Assistance Program. They're all pretty much the same. But when people hear those things, especially employee assistance, they think like, we're not going to utilize or call that person because that means I have a problem, you know? And we've tried to make it clear to his membership and to the union officers that there's no judgment, there's strict confidentiality, and these are things not to be ashamed of. If someone needs help, we're all tough guys, right? Construction workers, machinists, union, firefighters, but we bleed too, you know, emotionally and physically. And part of the problem is that shame or that fear of reaching out. Is it going to be confidential? Am I going to be judged? Am I going to be pulled off a job? And you know, no, there's no fear. There's no fear that you're going to be judged, and there's strict confidentiality. And the only time someone's ever going to be off a job is if it's agreed upon clinically that they need some help so they can go back to the job. You know, we want everybody to work safe. You know, you talk about going into confined spaces or working with people with heavy equipment, going into a fire. I'm sure nobody wants to be in there thinking the guy next to them or the person next to them might be impaired. Or they smell them come in early in the morning with alcohol coming from their pores. To cover up for that, yeah, that could have a problem continue instead of, hey, reaching out and saying you should call this guy, he can help you.
And it's also going to affect your comp. If the injured person comes back with drugs or alcohol, and we've seen this in the fire department across the country, where there's been several line of duty deaths where the alcohol or drugs may not have been a contributing factor. However, their benefits were denied based off having that in their system. And nobody wants to work with somebody who is drinking or doing drugs. It's like a union thing. You protect the guy, but we want to protect the guy to get him help. We don't want EAP to be viewed as a punitive thing. We want to try to save people's lives, save their family life, save their job. And we've seen EAP work wonders, not only with drugs, alcohol, but also the symptoms of this.
To call it lifestyle issues of a working man. You know, everybody brings your personal problems to work, and you bring your work problems to your personal life. And if you can learn how to manage that and learn some tools and techniques that are out there on how to manage it, you'll find that your whole well-being becomes a lot better. You know, the labor assistance professionals here in Connecticut, we have several fire departments that belong to it. I know there's Milford, Hartford was involved, a couple other ones, Stratford, and they attend our meetings. A representative attends our meetings and learns about, you know, the resources that are available through, whether it's, you know, you have somebody with a substance misuse disorder that needs treatment. One thing you want to do, and there's been a lot of publicity about not so reputable treatment facilities for inpatient treatment, whether it's billing or other problems that happen. So you want to give your members a good place to go. You want to give your coworkers a good place to go. So, you know, if you take on the role of an MAP or an EAP, you should know where to send them to vet the facilities and know that the treatment that they're going to get is going to be good treatment, so their success rate goes higher.
And that's key. And we do that in New Haven with our EAP rep. They're trained to handle firefighters. So there's already that training. They've been our EAP rep for, 20 years, 30 years. So there's that connection. And we try to bring them in on every recruit class and anytime that there's an issue, because then people see them coming around and the stigmatism isn't there.
Isn't there?
I got to go talk to the
And
EAP guy.
that's what Jerry can talk a little bit about, what LAP, what the labor assistance professionals can do for you, different chapters.
Yeah, well, the National Association offers a 2 or 3 times a year a 40-week training.
40 hour.
40 hour.
Yeah,
40
not
weeks,
40
yeah.
weeks.
Yeah, nobody would there, right? Or maybe they would, but a 40-hour training 3 or 4 times a year. Usually it's in, used to be in Maryland. Now I think they're doing it.
Woodlake.
And it's after those 40 hours of training, you get trained in substance abuse issues. You get, but also in union contracts, what kind of language maybe to have in the contract to be able to have your member assistance program be effective. At the end of those 40 hours, and with some other training throughout the year in your local chapter, you can get a certified labor assistance professional certification, which is equal to a certified employee assistance professionals certification. And you know you have someone in your department who's competent to handle all kinds of wellness issues, you know, family lifestyle, worker lifestyle issues. And one of the things that's happening a lot, and just thinking about families, this comes to mind, is we have a lot of people going to work where they might not have an issue, but they may have a spouse or an adult child that's, you know, dealing with addiction or dealing with some other kind of mental health issue, and it's affecting them on the job. And our member assistance program doesn't only cover the members of the union, but also their family members. And I'm sure it's the same with your program.
It's the same, and a lot of times, even in disciplinary issues, it's the symptom, not the problem. Mm-hmm. So you always got to get down to the brass tacks of whether, you know, this is a symptom or is there a greater problem going on at home.
Absolutely. You know, nobody gets up one morning and decides that I want to be depressed, or geez, I hope I have some serious anxiety issues that happen to me, or
I got anxiety today when I found out our trench training wasn't.
Relax.
I want to grow up to be an addict, you know. So you know, those are problems. You know, people, those aren't who that person is. That's something that's affecting them and happening to them. And there are solutions to get that person back to who they used to be and effective on the job again, so we don't lose them.
And it's important too to talk to people, because especially with substance abuse, you know, I'm a big believer in personal responsibility, and it may be a disease, but it's a disease of choice. But what I see with firefighters, and I would assume it's the same with the trades, a lot of times somebody gets hurt, they're given pain medicine.
Yes.
And then, so here, at no fault of their own, it really wasn't a choice. It's blindsided by, they have an addictive personality, or I don't know if I'm using the correct term, but they get addicted to the pain medicine, then they can't get it. And now, talking to a couple of DEA agents, they think that a lot of the, I mean, this is just arbitrary, but they think a lot of the heroin epidemic is because the pain medicine now is so well regulated that when people can't get their pain medicine,
absolutely,
it's moving to heroin, where before they would just keep getting a prescription for pain pills.
That's the absolute truth. I mean, they're regulated so much now that it's become more and more of an issue. Before that, it was a cost. You know, if you have a habit of, at the time, buying OxyContin off the street, you're spending $300, $400, $500 a day. Once your habit gets pretty serious with heroin, they can spend $100 a day, $80 a day. And so it was an economical issue. Now it's a supply and demand issue. But even someone who parties a lot and chooses that kind of lifestyle for a while, eventually they have no choice, because your brain gets rewired from the drugs, and you no longer are the same person you were before you're addicted, because you build up a tolerance. You need more and more to get the same effect, and what goes up must come down. So once you remove the drug, including alcohol, if you become addicted to alcohol, you go through severe withdrawal, and the only way to stop the withdrawal is to go to treatment or to take more of the substance that you're addicted to in the first place. So treatment and intervention, and not enabling that kind of thing, you know, thinking we're helping our union brothers and sisters. If we can intervene and get them, you know, into the treatment that they need, that's the answer. We're not looking to, we're not looking, like I said, not to be punishing, but to be therapeutic and to have everyone return to work safely.
And is it the same for you guys? If somebody has an alcohol problem, it seems now in society that they'll get to the point where they admit that they have a problem. If it's a substantial drug problem like heroin or crack or something like that, they get to that point really quick that they hit bottom. But what I see is the guys and girls who are hitting the pills, they don't think they have a problem when it's clear to everybody else that they're working with that they have a problem, but nobody wants to report it. Is that the same in the construction industry? Because if you're a company officer out there, take care of your people. You know, it's your responsibility to be there when they come to work. I'm sure it's the same as the operating engineers. You don't want somebody high on pills operating a machine.
What's happened in the building trades as a whole, not just operators, but all across the board, so we have an aging workforce. The median age of a union trade worker in the country now is about 40 years old. Median age for operating engineers is, I hate to say it, but closer to late 40s. So, you know, your body's only meant to take so much over the years.
And that's a hard job.
It's a hard job. You're up and down. You're getting beat up. So people will go to, you know, historically have gone to doctors for back injury, shoulders, knees, you name it, neuromuscular disorders, and they were prescribed. You know, they may be prescribed a low level of opiates, you know, 5 milligrams of Vicodin in the morning and 5 at night to help you go to sleep. Well, that continues over the course of the year, and depending on the doctor, whether they try physical therapy or alternative ways to alleviate the pain, some of them just kept prescribing and up in the dosage. And you know, hey, you put your trust in your doctor. If they're prescribing this, if they're doing, it must be okay. Well, then, you know, laws, in some ways, we've been our own worst enemies with some of the laws that we put limiting the way that the prescriptions are written. And I don't mean that to sound negative against the laws, but here you are, you're taking your medicine as prescribed to alleviate that pain, all of a sudden you get shut off. Well, what do? You go to work, oh, geez, my shoulder still hurts, somebody else, coworker, oh, here, take a couple of mine. And well, that 5 milligrams is now 20 milligrams, and they're taking it, you know, so you're up in your dosage, and all of a sudden your brain, like Jerry said, your brain gets rewired, and you know, the cravings become such where you progress.
And a lot of the doctors are naturally now concerned about their liability with writing the prescriptions because the laws have changed, the responsibility that the way they look at it has changed. And, but the doctors normally don't think about this person I'm prescribing for the last 2 or 3 years, I have to cut them off. Let me set them up for a detox and treatment. You know, they don't think, they just shut them off. And then that person's left fending for themselves. And of course, they're not thinking I'm going to go see my EAP or my MAP. They're thinking, who do I know on the job site that I know has pills? And so I think that's one of the things we can do is educate people if we know they're coming back to work after an injury, to be able to talk to them and let them know, hey, if you have any issues or
that's a good idea because people don't think about that.
Yeah, it's amazing the economic impact it has too. You know, workers will be making, you know, they'll bring home $1,200–1,500 a week, and $600–700 of that during that week is going towards illegal narcotics. And you know, the spouse is wondering why the mortgage isn't getting paid, why the car got repossessed, why the kids can't get new shoes. I mean, the economic impact is incredible, and it's a dirty little secret that's been swept under the rug for too long, and it's happening all around the country.
And we're starting to see it now in the fire departments where they're now finally embracing clinicians, EAP and stuff. So I think we're moving in the right direction. How is it with management for
they love the programs.
Companies? They do. Okay, so
they love the program
because I think a lot of people would think because the fire department was like, we don't want anything to do with it, and they kind of got kicking and screaming, got better. So can you speak to that?
With us, it's education. We educate our union employees, our business agents and reps on how to be compassionate and what this disease is, and it is a disease. We educate our members on the pathway to recovery, to remove the stigma, to let them know that it's okay. There's plenty of people out there that are in recovery, living in long-term recovery, that are doing just fine, and they're working and providing for their families better than ever. And we educate our employers. We spend a lot of time. I spend a lot of time with our signatory employers running symposiums, which Jerry's been involved in. I meet with them one-on-one, where they'll give our workers another chance, sometimes 2 chances. They don't want to lose them. They don't want to go through the cost of retraining them. These are good workers that have been with them for a long time in a lot of cases, and they're willing to work with them. And here again, I agree with you. A lot of it is self-motivation, the carrot and the stick. We hold the carrot and the stick. You know, here's your good paying union jobs with your benefits and your livelihood. Here's a way to get your life back. If you want to work, we'll work with you.
Because we all make mistakes. And
We all make
care about
mistakes.
each other.
Absolutely.
Accountability is much more effective than enabling. You know, these jobs are important to the workers, and we know, you know, evidence shows that if the job is on the line to go one way or the other, and if the person who has the issue addresses it and does well, that side of the line is you got your job back. You know, it puts responsibility and accountability where it belongs.
And technology is changing, so the guys that and girls that fake the drug test or the urine test for random testing, it's getting, the technology eventually is going to get there where that's not going to be happening, and you're going to start seeing in union contracts where they're doing the 10-panel drug test instead of the 5-panel drug test. And I'm going to bring something back to Rich Duffy, who I think he was a tradesman in the Carpenters Union first before he went to the IFF. And we were in Indianapolis at FDIC with Bobby Hall sitting at the table talking about a firefighter line duty death where they were under the influence. And he said, listen, if you want to smoke pot, then you can't be a firefighter. You want to sit home and smoke a bale of pot or do drugs. You just can't be a firefighter anymore. You just can't be a tradesman anymore. And that was 10 years ago. So it's starting to change because we got to realize this affects people's lives. Part
of the problem is medical marijuana and recreational marijuana that's sweeping the country now. I mean, states are looking at it as a revenue stream. Medical marijuana, personally, do I think there's a place for it? Possibly. You know, there hasn't been a lot of formalized research done on it from the FDA standpoint, but you know, the recreational marijuana, you hear some of the stories that are coming out of the states that have legalized it, and it's causing a whole other set of problems.
Oh, wait, hold on, because we're at the witching hour here.
Okay.
But you brought up a good point, and I want to ask how you're dealing with it, because I don't think the fire departments have reconciled it yet. What are they doing with drug testing drugs now that they're issuing cards for recreational marijuana or medical marijuana? That's happening not only in Connecticut but across the country, because it's recreational and because they're trying to tax it.
Well,
so how's that work? And that'll be our last. That could probably be a whole show.
Yes,
but
we should do it.
How's everybody dealing with that?
Myself and my colleague Andrea, we're both substance abuse professionals qualified through DOT. So any DOT safety sensitive jobs, which are federal regulations, marijuana with a medical card or not doesn't mean anything.
Okay.
It's positive test.
Okay.
Many companies that aren't federally regulated follow those regulations, like most of Kyle's.
So they use it as a consensus.
It's a safety sensitive work site, so they follow the federal regulations. And
so that's good for the fire department to know, because as EMTs, it actually comes through the Department of Transportation. So that might be an angle to ensure, because I truly believe that all of this stuff comes down to taking care of each other. And if we catch it with early intervention, that might be the key. So DOT, Department of Transportation, federal regulations,
state regulations for safety sensitive job sites. You can apply to, like the state of Connecticut, contractor can apply for safety sensitive designation, and then that kind of negates the marijuana type.
Okay, so how's that work on a state level?
Just apply to the state DOL, Department of Labor. They apply for it, and they basically fill out a form saying what the company does, how they do it, and then the state will make a.
And if someone fails a drug test for marijuana, either medical or recreational, and they're a safety sensitive work site, they have to be removed from the job until they go to treatment or get educational training. And Kyle's Union Hall 478 in Hamden, Connecticut, right, 1965 Dixwell Avenue, allows me and my colleague Andrea to go there every Thursday night, free of charge, open to the public. We have substance abuse and misuse training, which qualifies to get people back to work if they have a failed drug test.
Terrific.
There you go.
Terrific. It's about caring about people.
That's it.
And I think everybody here agrees. Earl, whether it's PTSD, whether it's drugs, alcohol, or a family or a medical issue, help shouldn't be that other 4-letter word.
Labor helping labor.
Labor helping labor. We want to ask for help. And if you're a volunteer department, find out what your town or municipality offers. But there's help out there. And I think the takeaway today is reach out to the operating engineers, no matter where you are. Start the relationship. Start taking care of each other. And it'll be mutual beneficial. And that's it for today's Google Hangout. I'd like to thank TenCate Fabrics and our great guests today. We've been tweeting this out live. This will be archived on Fire Engineering's homepage, Fire Rescue and Firefighter Nation. And once again, TenCate Protective Fabrics, make sure you reach out to them whenever you're doing any type of study based off of PPE. And it's another resource that can help you out. And thank you very much to Bobby Hall and Fire Engineering, Fire Rescue, Firefighter Nation, and Shannon, who makes this all possible from Oklahoma. We really appreciate your hard work and diligence. PJ Norwood, if you're interested in burning dollhouses, we'll be back next time. He's probably stealing some kid's dollhouse now, but we missed PJ, and this was a great show. So thank you very much.
Thank
Thanks
you
for coming.
Thank you, Frank.
Really appreciate it. Shannon, you can take us off.